am beyond excited for our guest today. We're having Bob Stern on the show for the first time. Bob has a celebrated career in engineering. His most recent role that he held was the principal metrologist emeritus at Keysight Technologies. I've been able to help Bob and several of his team members find their Medicare decisions. Also, Bob holds the role of husband and father. He's lived in the Bay Area, and he recognizes, along with all of you, that healthcare is really expensive, and navigating that system can be super complicated. Bob's going to kind of talk us through his experience of getting Medicare, really getting enrolled in the Medicare program, and really ensuring ongoing that he's on the right coverage. So I'm excited to welcome Bob to the show. Welcome, Bob, for the first time. How are you?
Hi, I'm good.
Thank you so much for choosing to join me. Bob, you and I both have birds in our house, so they may start talking to each other while we're talking, and they're just part of the deal. So they're definitely part of the healthcare journey. So we'll make sure that they're a part of this. So Bob, just tell me a little bit about your background. How did you end up in the Bay Area?
Well, when I graduated from college as an electrical engineer, it was a long time ago, and at that time, you just about every interview you did, you had a chance to get a job offer. I think I might have had 8 offers or something.
Wow.
At the time. But my second to last one was with Bell Laboratories, and I was pretty excited because for somebody with a master's degree, all the theorems that you would have studied were developed by people who worked at Bell Labs. So
you were amped up. This is where you wanted to be.
I went to 2 sites, and it was kind of, it was really interesting. And just as I was walking out of the last one of the engineers that was my host, he said, "Here, let me show you one of the best parts." And he opened this door to the equipment pool, and it was stocked all the way to the ceiling with Hewlett Packard instruments. And he said, "That's all we use. They're the best." And turns out I had one interview left, and it was with, guess who? Hewlett Packard.
And the rest is history, right? So that's pretty incredible. So tell me, how did you end up landing there? And was the position here in the Bay Area? Where were you from originally? So how did you land specifically here, Novato area?
So HP is one of those companies where people don't really leave because it's so good. And I worked for a number of different divisions. So I started out in Palo Alto, and I lived in like Mountain View, Palo Alto. Finally, Sandy and I, just before we went to Scotland, we bought a condo in San Carlos. And then when I came back from the Scotland assignment, I got a promotion up to Santa Rosa, but we moved to Novato, which was halfway to Santa Rosa because we still had a lot of friends in San Francisco, and
you wanted to keep yourself split for fun and for work.
Yeah, and it's a nice place to be, so we've never really left.
Yeah. So tell me about what it's like to, well, first of all, define for us, what is a principal metrologist? And Hewlett Packard, tell me about the transition to Keysight. Tell me the story and tell me all about that. What did you do? What did a day-to-day look like for you? Obviously, you had the best tools and equipment and the best place to work, right? But tell me about what that work actually looked like.
Well, Keysight makes electronic measuring instruments, and they're, to people that don't know them, you wouldn't have heard of it. But whenever somebody asks me, what did you do? I hold up a cell phone and I go, everything it takes to design these. And just a minute, I have to plug in my battery. It apparently is not plugged in. One moment. I thought I plugged this in. Just a minute. Sorry.
No worries.
Hopefully it's charging now.
Okay, so are you charging?
Yes, I don't know what happened. It was plugged in. It must have. Anyway,
Okay. So
I was saying,
give me 1 second before you answer, Bob, because I'm going to do a clap, so they'll cut out that little search. So give me a second.
sure.
Go ahead.
Principal metrologist, this was my last job for, I don't know, the last 8 years or so. And, when I started out with HP, I was in the marketing department. I used to write a lot of software, and HP was a company that invented programmable instruments. So all of a sudden, in the 70s, that was new, and you could automatically test things like two-way radios, or CBs were big for a while. And then as the phones came along, to be able to test all those things automatically. And so I was heavily involved with the marketing and all of that. And it was always fun because you get to meet a lot of customers, you find out what they needed, and then you'd work with the lab to try to invent, to put in those requirements in the next instrument. And then when we would bring them out, you'd get to show them to people and they'd be all excited, and you'd sell a bunch of them. And, it was a lot of fun.
Good times. Yes, definitely.
And at a certain point, somewhere around the year 2000 or so, there was kind of a crash, and economic crash. And so there was a lot of rearranging. And I ended up being asked to move to the service organization, which up until that time I hadn't really done much of. And they asked me to get into that. And then it turns out that in order to maintain all these instruments, you have to perform periodic checks to make sure that they still meet all the specifications that they're supposed to. And that's called calibration, which is what I've been doing for quite some time. And like a lot of other things, it has international standards that you're supposed to comply with. So I became one of the principal people for HP that was responsible for making sure that we would comply with any of these standards. And in fact, that's what the emeritus stands for, is that although I'm officially retired, I still work on the standards committees for, it started out as HP, then it moved on and became Agilent Technologies. And the last one now, the current one, is Keysight Technologies.
Right. So tell me a little bit more about this emeritus portion, because I know you're still on the speaker circuit for conferences. You're really connected to the work world. I mean, retirement, I feel like it's a soft retirement for you. So tell me a little bit about what that's all about.
Well, the Keysight's, I would say, pretty smart in recognizing that a lot of the senior talent is sort of unique, and they don't necessarily always have somebody ready to step in, or in some cases, so to some of the employees that have, that I guess are ranked well or high or something, they offer the opportunity to, instead of just retiring cold turkey, to be able to gradually go into it. So they actually have two programs, an Emeritus 1, which I did for about 4 years, which is you can work 20, 40, 60, 80%. And if you're over 50%, you still get the company health care.
Oh, nice.
And you get profit sharing and stuff like that. So that's what I did. I did that at 60% for a while. And then when you do retire, now you're collecting your pension.
Yeah. Mm-hmm.
And you can still work if it's mutually agreeable. If you're interested and they want you, then they have an Emeritus 2, which is what I'm on now, and that is 20%, no more than 20%.
I like that percentage. That sounds better.
Well, it's good. I mean, I don't really work 20% any given month. When there's an active standard, I'm practically full-time for a while. And
Right.
then maybe the next month I don't really do anything. But as long as I keep track of all the standards for the company and let them know what's coming, because it's a two-way street. They want to comply, but they also want to influence to make sure that any new standards are smart, shall we say, in that they don't put in requirements that are going to be, overly difficult to meet.
Completely get it. So, I mean, what I like about it is that you get to keep passing your skill on and really developing the newer people, because they would really lose out significantly if they didn't have you to kind of carry the torch and represent them. So that's pretty cool work.
Yeah, I mean, when I was working full time, I used to go visit customers all the time, but a lot of it was education just prior to them making some very large um, order for calibration. So, it was always a little bit of high stress, and I was trying to help out with competitive situations. So now I don't travel to all the customer. I mean, I thoroughly enjoyed that, but you don't have the, gee, I need this analysis by tomorrow at noon. I don't
Relieves a
do
little
any,
of the pressure, but you still get to stay close to it. I love that. So,
yeah.
well, in all that you're sharing, Bob, I mean, not that it wasn't clear before, but I mean, you're amazingly intelligent. I mean, anybody who gets so excited about opening a door and seeing a bunch of HP equipment, we know you're all good, right? You're in it to win it, and you've been so successful. And when I think of someone like you, I mean, you would say, well, gosh, navigating healthcare should be super simple, right? Because like you're super smart and you do all these things. And I know it's not always the case, right? And healthcare decisions are really important. Um, Tell me a little bit about your experience. Like, why is it so important with you? And, what did you find? Was it easy to navigate? What's been your process?
Well, after we met you, it was easy.
Well, we like this. Testimonials to me is good. I love
Um,
it.
no, what I would say is, as people approach retirement, they, when you get to be, I don't know, somewhere near age 60, you're going, okay, what is retirement age, this and that, and to a certain extent, you're tired of working. So, there's always somebody that will tell you, you're not 60 years old, you're 5 years old, and you're counting down.
Right.
And so when you get to the retirement um, point, then obviously, the full age, there's the Social Security, and then with respect to once I retired, of course, then I had to pick a you know health coverage, and I'd been with Kaiser for a long time, and they treated me pretty well. Um, and I had one out of state situation where I had to have two bypasses put in for heart surgery. And when I was in Florida, and fortunately it worked out okay. And I didn't have to, worry about a whole bunch of bills, but I used to see a whole bunch of paperwork going back and forth and go, my God, I hope that's not me
Right.
responsible for any of that. And it turns out it wasn't. Kaiser was good about that. But even with Kaiser, you really kind of have to be in your coverage area. And I learned this with my son, who was in Southern California, um, and he had to have some kind of surgery, but he was the wrong area of Kaiser, and he didn't get anywhere near as good a coverage. So Sandy and I like to travel, um, both inside and outside the U.S. But inside the U.S., one of our goals was we didn't want to have to worry about, um, are we out of the zone or any of this other stuff. And one other thing about Kaiser is if you've got a serious issue, you have to be a little bit assertive. You can't just go and say, hey, I need this. So again, I I think their Medicare Advantage, a lot of people seem to like. We know people that are on that. They're generally pretty healthy, and they're quite happy that it doesn't cost them very much. But like a lot of things when you retire, you call friends who just retired at Keysight. I talked to some of my best friends that had recently retired, and I said, "What did you do? And how did you figure this out?" And they started to explain to me all the different parts of Medicare, A, B, D. I don't know. There, I guess C might be, and all these things. So I mean, it sounded a little, wow. And we went to one of your seminars, and you were walking people all through these, and so then I realized pretty quickly, okay, they aren't that hard to understand because you explained them nicely. Anybody who paid into Medicare has A, that's hospital. Okay, good for that. And then the B is all the doctors that you normally see, except for you only covered up to 80%. Well, 20% can be pretty big. And that's the other thing is I was tired of copays. So when it was explained to me by you that the supplementals would there'd be no more copays because all the years that I worked, if you have a cold, you go, okay, is this a $40 cold or
You're really giving it some thought before you access the care that you need. So
yeah, and I just thought I'm not going to go more. I just don't want to deal with that sort of stuff, and I'm sure I think it was years before I got COVID and it was during Medicare, but I just like that I don't, if we need something, we just ask and we get
right.
it.
Well, what you're raising, Bob, is just sort of a fundamental choice or decision that people have to make once they get full Medicare. So whether that's right at age 65 or it's later because you're still working and you have employer coverage, when it comes time to take Medicare, generally speaking, once Medicare becomes primary in your situation, you have to take it. And then you're left with this decision. Do I want to go with a Part C plan, like a Kaiser Senior Advantage or some other Advantage plan, or do I value the flexibility of being able to use my Medicare card wherever I want, and I want to do something like Medigap? And that's obviously the path that you and Sandy chose, and you've done really well. One of the things that I have found is that it can be incredibly difficult for someone to move from a model like Kaiser, which is a staff model where you use only Kaiser doctors and everything's sort of under this one roof, and transitioning to a plan that, although freedom is great, you may not know where to go or finding a doctor or that kind of thing. Tell me a little bit about the transition for you and Sandy from a Kaiser model to finding your own initial doctor and how that process has worked for you.
So here in Nevada, we have Marin Health as part of, I guess, the Sutter facilities, and they're literally a 1 mile exit from our house. So they're very, very close. They have, the general physicians, cardiac people are there. If you need, bone surgery or whatever, they have access to all of that. So it's all very local. I guess my biggest surprise was I knew something about that Medicare paid less to their either to the doctors or et cetera than regular rates. And so I was always apprehensive, will the doctors be as good? And it turns out they've been as good as any I've ever had. I mean, I never had any complaints about Kaiser, but I've got nothing but good things to say about literally everybody I've seen inside of the Medicare system that's associated with Medicare.
Right.
And they've been so good that the one doctor that we had, and her name is escaping me right now, but she's in a private practice right now. You know her because you've talked about her in your annual updates to people. Yeah, Dr. Kohler was her name.
Yep.
Anyway, one time I actually got the courage up and I said, I thought it was going to be, harder to find good doctors under Medicare because, maybe they don't pay as much. And she smiled and she said, yes, but they pay the first time.
They don't give them a lot of trouble. They make it easier to work with, right?
Yeah.
There's not a lot
Yeah.
of arguing back and forth.
so I never asked the question again, but I'm happy to report that anybody I've seen has been very, very sharp. It's obvious. And she moved on to a private practice, and the new person that I have easily is sharp, just well read on the latest stuff. Just I just feel mighty fortunate to have this healthcare, I guess is what I would say.
Right. Well, and I think a lot of times it can be daunting, right, to move from a system and just try something new and gosh, questioning what will the quality be like. And I think for people coming from Kaiser, and what you kind of highlighted, Bob, is you transition to a system, but it's not like you're for everyday things, you want to go to the Mayo Clinic or Stanford or whatever. You want to be able to access good healthcare locally. And there are plenty of doctors and physicians available in these local areas that can treat you for most things. But what distinguishes a supplement, Medicare with a supplement, from other plans that are out there that may even utilize some of those same doctors is that it doesn't restrict you from looking at other things. So if you and Sandy go to New York City, or if you're in Los Angeles, or you're traveling, or you hear of a specialist you want to see, as long as those providers take Medicare, it's going to give you that greater access. So care is still local and close to home most of the time, but it's that access that you're taking advantage of. And it sounds like you've had a great experience. I love it.
Yeah, I mean, that was one of the things on our mind is I think San Francisco General is noted for their orthopedic surgeons. And yeah, I'm lucky. I still have original knees and original everything else, but you never know. I mean, I do ski a lot. I might need something at some point, but it's not like you say. It's nice. I think you can even go to Stanford if you wanted to.
You can. Anywhere Medicare is accepted. Right.
So I mean, if there's something that's tricky, where you feel like you really need somebody and you're willing to travel for it, I guess I like the idea of knowing that it could go to San Francisco General or even Stanford if we had to, or felt we needed to.
And it just makes it really easy to use for sure. So now I've helped a lot of Keysight retirees specifically with their coverage. Is that how you got connected to me originally, that you got referred by friends from Keysight that sent you my direction?
No, I've referred other friends who
You're the one that started the chain of events, Bob.
No, Sandy got a flyer, and you were at a local horrible pizza place here in Nevada, and
I do pizza and Medicare 101s. That's my program, so I love it. So that's how we
yeah,
initially.
as a marketing guy, you can get just about anybody to come for pizza, but she came across a flyer or something that you were doing this, and so we thought, yeah, we'll come, and obviously it was, you were throwing out all the information on the numbers and what different things were cost, and you knew, what all the different plans had, and so that was extremely helpful to us, and I think we were able to do the Part F before. Well,
before the 2020 and all that.
Yeah, so we got in on that one, and we were, and I'm very happy. I mean, at this point now, and then I get Medicare stuff that that has numbers in it, and I just staple them and put them in a file.
You're like, I'm going to call Aaron with this. I like that. That's what we're here for too. If anything comes up that looks a little bit weird, so
the one.
Oh, go ahead.
The one thing I guess is, where you've been especially helpful is, I do have 3 expensive drugs.
It's so funny that you're bringing this up, Bob, because that's literally what I was just going to ask you. So talk to me about prescriptions, because I know you've had some pricey ones. So talk to me a little bit about navigating that.
Well, so I've been overweight, not obesely, but overweight for a while. And as a result, I have diabetes 2. And so there's a number of generics that you have for that. But, my doctors like to put me on Jardiance, and that's one of those that you see on TV. Obviously, anything on TV is expensive. So
That's my mantra on that as well. If you see it on TV, you're in trouble.
yeah, and recently they put me on Ozempic, and that's been helping with weight. And
You look great, by the way.
yeah,
So
my heart, I had high blood pressure for many years, and now I don't. Um, so I think it's a combination of exercise and some of these meds. Um, anyway, so some of these can be pretty expensive, and you have done, you and slash your organization requests that we give you a list of all their meds. In my case, I think there's 9 of them, and 6 of them are generics. They're $0, and 3 are expensive. And it seems like every year a different plan wants to treat them slightly differently. So I think in 5 years I've changed 3 or 4 times at your um, suggestion, and so I appreciate that you look, that your team looks through carefully, and that allows me to get the most cost effective for what it is.
Right. So, and what you're really referencing, Bob, is the annual election period each year. So that runs October 15th to December 7th. And this is the opportunity for people on Medicare to add or change their drug coverage. And what I have found is, in my experience, I come across people all the time that never check it, right? So they might be on a plan that's not even covering their medication at all, or not covering it as well as the other options, or maybe the premium has gotten significantly increased. And so it's not a set it and forget it type of thing with prescriptions. And so I love the partnership that we have to check on that each year. How valuable do you think that would be for others? In terms of, it's obviously had value for you and Sandy, but if you didn't have that, what do you think you would be doing and choosing relative to prescription coverage?
Honestly, I know if you have Kaiser Advantage, the drugs are part of that, so you don't have to think about it, and hopefully it's good because you can't really change it.
There's no point of comparison, right? That's just what it is.
So I don't know how it would be if I were still in that, but I know that people who are in those supplements don't, at least with Kaiser, they don't think about it. But for me, I'll see an article in the Wall Street Journal that says that the cap is going down to 2,000, or the donut hole or whatever they call it is going down to 2,000 max out of pocket. And I go, okay, I don't really like to, I kind of save the receipts when I pay for stuff. The first intelligent thing that I did is switch all my expensive drugs to Costco. So now at least I get the Costco rebate on all the money I spend on drugs.
Oh, that's smart.
Yeah. So I recommend that to anybody that has to pay. And, and this year you gave me a couple choices. They were close, but one of them was, I was clearly going to go over 2,000 for the year. And, so you said, hey, this one, you'll pay out of pocket, then you'll be done for the rest of the year, which is where I'm at now.
Fantastic. I know it has gotten better, which is really, you can't always say that about things, but in healthcare, this is one instance where it's actually reversed itself and improved a little bit on prescription drug costs. You talked about some of the ahas you've gotten, like for instance, obviously working with me, but also like the Costco experience and using the rebates. Are there any other things that you would share, any ahas or helpful tips that you would have for other people making this type of a decision?
About the whole programs, or
yeah, just figuring it out, like in terms of little tricks of the trade that you've learned along the way. You figured out this Costco piece. Obviously, you've worked with me. If you were to go back to those 60-year-olds who are contemplating retirement and saying, like, I'm a 5-year-old counting down, what advice would you give them to make a good choice?
Well, to my friends at Keysight, what I've said is, are you on, are you doing health maintenance, or are you doing, where you're picking your own doctors already, or are you maybe with somebody like Kaiser? And if you're with Kaiser, are you happy? And then the other thing is, how many drugs do you take? Because if you just take a few, like my wife Sandy, she takes barely anything. and she's on. You picked a plan for her that has a very low monthly payment, and it works fine for her. So
Makes sense.
she's
And that
pretty.
ability to navigate it makes a difference.
Yeah. So I just tell people, you just have to understand that everybody has Part A, Part B. You're going to continue to see doctors, but if you don't like copays, you're pretty much going to want to go with some Medigap, and then there's some fairly obvious choices if you're going to go that route. And then, do you like to travel, and how much is it worth it to you to be able to maybe go to a specialist that you know of, that if you've got orthopedic special issue or
Right. Just keep that option open. And, even on an Advantage plan, sometimes you can get to those other specialists or doctors, but it's somebody else's decision. Just like you were talking about earlier with Dr. Kohler in the reference to they pay the first time. With Medicare and a supplement, you can self-direct the first time. You don't have to wait or jump through hoops. You can get where you want to go. So I think that's really a big perk to being on this type of plan. So, you talked about travel, you've talked about skiing, I know you're working somewhat, but it sounds like you're finding time to enjoy life. What are your and Sandy's big priorities for the next year? Any big trips planned?
Yeah. In fact, right now I'm trying to get in shape because we've got an Italian, not Italian, an Alps hiking tour starting in Prague in July, and then 10 days later ending up in Salzburg.
Wow, that's a big trip.
It is, but that'll be 9 days, but we're going to be gone for a month. And after that, we'll take some trains down to Venice and Florence, and then train back up to Switzerland and hike for another 10, 12 days or so.
That sounds incredible. So when you hike, are you camping out on the hiking, or do they have accommodations for you? Oh gosh, I was like, wow, I don't know if I want to be camping too much in my retirement. So, so you're staying at some nice places.
Yeah, no, this is the first one. Maybe give them a mini plug is Mountain Sobek in Berkeley. They do really nice trips, and so in ours, I think we're only going to have 5 people, but it's a guided tour. Just imagine you're going to be in UNESCO type cities and stuff, taking photographs, and you go on hikes, and they have different levels. The one we're on is a level 3. So some days we'll maybe have 1,800 feet of vertical, but not 4,000 or some crazy thing like that.
Not trying to kill yourself here. You're trying to enjoy yourself.
Yeah, I mean, it's not like trying to hike up to the top of Half Dome or something like that. So
sounds amazing. What a great organization you got connected with. How awesome. I love it. So that's fun. I bet you meet some cool people too.
I'm sure we will. And, we'll be staying in nice places, and, won't have to worry about good food or any of that. So and each day, all we have to carry is, our camera and our day pack and stuff like that. So
sounds perfect. I love it. So, well, I just want to thank you for coming on today, Bob. You're amazing, super smart person. I love you and Sandy. You're 2 of my favorites. You've sent me so many people, which I so appreciate. Is there anything you want to leave the audience with today? Any take-home message?
I would go back to the one other bit of advice, depending on is there's a thing called, what is it, IRMA?
Oh, IRMA, income related monthly adjustment amount. Yes.
Right. So, when I retired, I hadn't been sick in 20 years, and I got all my back sick pay, and that threw me over a limit. And so all of a sudden I had, 2x on the Medicare Part B, which was, quite a shock to me. And like a lot of other things, I called up one of my old Keysight friends, because they had been a salesperson. I knew they had done well their last year. And I said, did you ever hear this? And I said, oh yeah, here's what you got to do. So, they helped me understand that I needed to go down and talk to the Medicare people, and I got it cleared up. But I'm an engineer, so
Right.
so I have spreadsheets for everything. And while I was working, I never had a spreadsheet for projected income.
Really?
But now, because you have this, Sandy has a pension, I have a pension, there's Social Security. Later this year will be my first time I have to do mandatory withdrawals. So I keep a spreadsheet so that I know where I'm going to be with, taxable income. And I track the IRMA limits each year just to see, am I going to be close? Because, you talk to a financial advisor, their advice is, hey, if you're within a couple thousand, maybe you want to donate something to a charity.
Right.
And if you're going to be over, can you be over by a lot? And so you don't just suck it up and do it.
Right.
So
Exactly.
anyway, that's something that I now watch.
Yeah.
That I now watch, which I never did before, but it's like, if you're gonna, you don't want to be surprised because you went over one of the limits, is what I'm saying.
You got it. Well, I mean, you're obviously a planner, you're an engineer. Maybe you can sell your software for retirement planning and tracking income. That'll be your next business venture. But I think that's great advice to give everybody, and just really being smart about it and knowing the process you referenced is a good one. And basically what you were talking about is if your income was higher a couple of years ago and now it's lower due to a qualifying reason like retirement or reduction of hours, you can qualify to get premiums reduced in the current year, and that you successfully navigated that process. And then I think what the smart advice you just gave is that a lot of people are not mindful necessarily of, hey, Medicare is adjusting these premiums every year based on your income 2 years ago, right? So if you have highs or lows, or you haven't been controlling it or monitoring it, you could have a real surprise as you're referencing. So I think that's great advice. Everybody should be tracking that. Maybe we won't do it as well as you do, Bob, but I think the advice is great and amazing, and I appreciate you sharing that. And just thanks so much for joining today. You and Sandy have a fantastic time on your trip. You better send me a picture. And I appreciate you sharing with us today. Thanks so much.
My pleasure. Thank you.